While it may seem like a rare or even taboo subject, anal cancer is a serious and increasingly prevalent disease that too often flies under the radar of early detection, largely because its symptoms can be misinterpreted or dismissed as signs of far less serious conditions. Unfortunately, this very confusion can lead to delayed diagnoses, missed opportunities for early intervention, and ultimately, devastating outcomes, especially in older adults and particularly in women, where the rates are rising at an alarming pace. Anal cancer is not the same as the more commonly discussed colorectal cancer. It is a distinct malignancy arising from the tissue of the anal canal, and it is heavily associated with chronic infection by the human papillomavirus, HPV, a virus that can linger in the body for years without symptoms and quietly damage cellular DNA. The danger here is compounded by the fact that 90% of anal cancer cases are directly linked to HPV, yet awareness of this connection remains dangerously low among the public and even some segments of the medical community. The latest data shows a troubling trend: a nearly 3% annual increase in cases among women, with white and Hispanic women over 65 being hit the hardest. These are demographics that, until recently, were not seen as high risk. Many of these women missed the initial public health campaigns promoting the HPV vaccine, which wasn't widely available or recommended until after they had already aged out of the eligibility window. Now, the lack of immunity leaves them vulnerable, and this vulnerability is made worse by the insidious nature of the symptoms. The signs of anal cancer are tragically easy to overlook. Most people experiencing rectal bleeding, anal itching, or pain during bowel movements will assume they're dealing with hemorrhoids, a far more common and benign condition. Similarly, the presence of small lumps or growths around the anus might be mistaken for skin tags, anal warts, or harmless irritation. The truth is, these symptoms can all signal the early presence of malignant tumors, yet they are rarely taken seriously until the disease has advanced. By then, the cancer may have spread to nearby lymph nodes or even metastasized to distant organs, making successful treatment significantly more difficult. Other subtle but dangerous signs include anal discharge, changes in bowel habits, or incontinence, all of which can mimic symptoms of irritable bowel syndrome, infections, or aging-related digestive changes. In many cases, the disease is already in an advanced stage by the time it is identified, not because it is silent, but because it masks itself behind familiarity, behind symptoms society is conditioned to ignore or attribute to embarrassment or aging. The tragic irony is that anal cancer is highly preventable with timely HPV vaccination and potentially detectable through targeted screening, yet public health efforts are still catching up to the urgency of this growing problem. If the current trajectory continues, researchers warn that the incidence of anal cancer in women over 65 could double in less than 2 decades. This is not a projection we can afford to take lightly. Prevention measures, particularly HPV vaccination among both young men and women, must be expanded and supported with strong public messaging that dismantles the stigma surrounding this cancer. Furthermore, healthcare providers must be trained not to brush aside anal complaints as merely hemorrhoidal. A quick dismissal based on assumptions can cost a patient their life. Persistent symptoms, even ones that seem minor, should be investigated with diligence. Rectal bleeding that occurs more than once should not be ignored. Discomfort that doesn't improve should not be self-medicated indefinitely with creams and over-the-counter suppositories. The burden lies not only with patients, but also with a healthcare system that must sharpen its vigilance. Equally alarming is the potential for HPV-related stigma to prevent open discussion or timely medical consultation. Because HPV is sexually transmitted, many patients, especially older adults, may feel shame or embarrassment when discussing their symptoms or asking about the vaccine. This cultural silence can be deadly. The virus does not discriminate by age or morality. It is a biological agent, highly prevalent, often asymptomatic, and in some cases, devastating. There is also a stark lack of education around the need for routine checkups that include anal health assessments, especially for those in high-risk groups such as individuals with a history of HPV, immunocompromised patients, or those living with HIV. The healthcare system must shift toward a model that normalizes these conversations and provides screening protocols without shame, delay, or judgment. In the end, Anal cancer remains one of the more underdiagnosed and underdiscussed malignancies, and the consequences of this neglect are being paid in human lives. Rising rates among women, once thought to be at low risk, should serve as a wake-up call, not only to researchers and physicians but to society at large. We must speak openly, screen proactively, and educate relentlessly if we are to reverse this trend. If you've experienced any of the listed symptoms, no matter how minor or how easily dismissed, they should not be ignored. The cost of assuming it's probably just hemorrhoids could be years of life lost. Awareness, vigilance, and action are our best defense. Would you like guidance on the HPV vaccine or screening recommendations based on age and risk level?